Welcome to the Registry Insider. I'm Bill Seifarth, CEO for the National Registry of EMTs. And on today's episode, we're filming from the EMS World Expo Convention Center at the National Registry booth at booth number 328. So joining me for today's episode is the world famous EMS Avenger, Jimmy Apple. So Jimmy, thanks for joining us today for this episode.
I'm happy to be here. Thanks for having me.
So as I said, the EMS Avenger is pretty famous in the EMS circles on social media, and he does a lot as it relates to bringing awareness as well as just general visibility as far as issues that are going on national and at the local level for EMS clinicians. So if you can, tell us a little bit about your background, Jimmy, as well as your passion as for your space and place on social media related to EMS.
So I am a 20-plus year paramedic.
Mm-hmm.
It was a second career for me. I was an electrician before that, something that I just kind of backed into, so I didn't necessarily, I was good at it, but I didn't have a passion for it, and I didn't want to spend the rest of my life doing it. I wanted to do something that was meaningful, so I took an EMT course on a whim, and I fell in love with it, and I knew that that's what I wanted to do, but not only did that ignite a passion for EMS, it ignited a passion for learning. I wasn't a good student in high school, and that passion never stopped after I got out of paramedic school. And so after that, I continued just to learn and pivot and then to teach students who are on my truck. And teaching actually became a passion as well, but I never wanted to bring that into the classroom. And I was always infatuated with being in front of a camera. And when social media hit, I was infatuated with social media. And all that converged to allow me to be able to talk about the things that I'm passionate about and to be able to actually teach and to talk about EMS in front of a camera.
Awesome. So kind of the convergence from electricians, I'm assuming you're really good with the electrophysiology of the hearts.
I do like talking about the electrophysiology of the heart.
No, sure. Couldn't resist that. But also that passion for social media and getting the word out there and educating. Because I think social media has a great opportunity to inform on little 30-second to 2-minute clips. And EMS clinicians, whether it be on educational stuff or dispelling rumors or confirming rumors, it's a good way to get the word out there and offer education in small sound clips or small bites that is informative and timely as well.
Yes.
So EMS Avenger, how did that start? Obviously, I think you kind of led up to that, but where did you get to the word EMS Avenger or the title EMS Avenger?
Well, I mean, I grew up a comic books fan. I was infatuated with superheroes, and as a kid, I mean, my grandmother had a scrapbook of all the drawings I made of Superman, and Batman, and Captain America standing next to each other in a hero pose. And when the Marvel movies started coming out, right, that was something that I did together with my son, which was go see these movies. And when I started kind of developing a footprint on social media, because I was working social media even before the reels for that came out. I was thinking of maybe a blog or something, and my kids suggested that it be EMS Avenger, and I was like, yes.
That's it.
Absolutely.
So what platforms are you on?
I am on basically all of the major ones. So TikTok is kind of my home. I get a lot more engagement on Facebook. That has blown up over the last 8 months. But TikTok, Instagram, Facebook, YouTube, and LinkedIn. Awesome. And I also have a podcast on major podcast platforms.
Good. And obviously, full transparency, we at the National Registry discovered you or had contact with you a few months ago when we had the IT challenges that we're facing, and you were very responsive to us in terms of some of the initial information that was put out there was not accurate, and we appreciate your correcting the post and updating it. And since then, we've kind of developed a bit of a friendship or a collegial relationship where we could have you on our podcast now. So thanks for joining us for this episode.
Absolutely.
And in responding to the request to update the misinformation was posted. So if you have a shirt that says "Saving Lives Begins with Kindness," tell us a little bit about that and what it entails and where people can go to find out about that.
So I'm very into like education and breaking down data and getting the studies and things like that. And I want people to be better clinicians. That's ultimately the goal. We want better outcomes, but I don't like that can often happen in the back. And I think that to improve the provider, that you really need to improve the person. To be a competent provider, you need to be a competent human being. And it's great that you know when to defibrillate. It's great that you know when to push dextrose. It's great that you know everything there is to know about ketamine and push dose pressors and whole blood, all the sexy things that we're talking about in EMS. I shouldn't say sexy. There's people that just take issue with me saying things like that. All the hot issues in EMS. But ultimately, you are going to save more lives by being kind to individuals in your career than you ever will with the button on the You're going to meet people who are on their last rung of the ladder, who just need a kind word, who their lives, they have almost forfeited them. Maybe they made some bad choices a long time ago, but they're way beyond that, and they just need someone to be kind. And so I'm trying to champion an effort to, I don't want to say return kindness to EMS, but put it back on the forefront so that we can actually start leading with kindness. We've been so consumed by kind of the gallows humor that can consume our field that people have almost become resentful of a suggestion that we be virtuous. And so I have T-shirts that you can buy that say "Saving lives begins with kindness," but the message is more important.
Where can people go to find out about these shirts so that message can be out there even more?
I do have a merch store that's on Bonfire. So if you search EMS Avenger Bonfire, it'll bring you to my merch store. I'm not really trying to hut shirts. I just want the message to get out. In fact, somebody asked if they could put that on a T-shirt, another company, and I was like, yes, absolutely. I'm not trying to profit off this at all. I just want the message out.
Yeah, and that actually, I think, resonates even further as to the message itself. Like, you don't want to make money from it, but you want the message to get out there. So kudos to you for that. In terms of you as a clinician, obviously you've been 20 years as a clinician, passion for education. Are you still active as a clinician?
I full-time am a neonatal and pediatric critical care paramedic, transport paramedic. I kind of took things to the next level from 911 a couple of years ago. I still occasionally work 911. I think it's very important for me to be grounded and actually work in the field to add credibility to what I do.
Absolutely. I agree with that. And in this circle myself, hence I maintain my paramedic, not active as a clinician. I don't have the time for it, but I think it is important to do that to maintain some sense of credibility. With respect to the EMS today in the year 2025, what are your, I won't use the word sexy topics either, because apparently that is technical. What are the hot topics that you notice most commonly that are on your channels that you're having to either talk about or spread the word about? What are the hottest topics today for you?
So I find myself every year circling back around to some myths that tend to persist. Yeah. The nitro, withholding nitro in inferior and right side end parts. I tend to circle back around to that every year. The hypoxic drive thing. Right now, the big thing is the NAEMSP paper on backboards and seat collars.
Yeah.
That's a big topic right now. Ketamine is always a big topic.
What about blood?
Whole blood is a huge topic right now. In fact, yesterday I visited with the IU team at the Indianapolis Motor Speedway, and one thing I wanted to ask them about is if something bad happens, do you have whole blood? And yes, they do have whole blood.
Good.
So it is, it's popping up everywhere. We carry whole blood where I work, and that's a big thing. Yeah.
So pretty consistent topics. The only topic I would say that we've seen clinically that is keeps emerging is mobile integrated health community paramedicine, which you heard us finishing an episode.
Yes.
When you came to the other room we were filming in, but that is also a hot topic.
Mobile integrated health is a hot topic. However, it's a hot topic that tends to exist in a tier above the
Good, that's where I want you to go.
provider.
So explain a little bit more about that in terms of where it's popular versus not so popular.
So mobile integrated health, for people who are listening who may be out in the field, is an effort to kind of catch the person before they become a
911 case.
A 911 case and maybe a repeated 911 case, right? And so we want to catch them a little bit earlier to make sure that they're getting the care that they need, to get some treatment to them that will maybe get in the way of some downstream effects. And it's something that can really enhance the capabilities of a provider. And I think when a field provider hears that term, they probably think that this is something that is happening overseas, and they don't realize that this is a huge push that's happening here. And I don't think they realize how fast that this is happening. And I think that as you see, like the legs getting cut out, things like Medicaid, that this is going to be even more important. And this is something that a provider who is stuck, who hates everything about what they're doing right now, it's like, okay, you wanted to do more important things, here you go, and without any of the things that you didn't like about 911.
Yeah.
So, yeah.
And, the average lifespan, I hate saying the word lifespan, but the average time or tenure that an EMS clinician has in the field is 5 or less years. And just a few years ago, it was 7 to 8 years.
Yeah.
I mean, it's decreasing. The pandemic, I think, had a lot of negative effects to that. But as you're saying, mobile integrated healthcare or community paramedicine, some different approaches to specializing in EMS is a potential opportunity or an avenue that clinicians can take so they don't get burned out running back-to-back 911 calls, the same patients, the same kind of encounters. It's generally probably a lower acuity, it's certainly less urgent, and it is more preventative than it is reactive.
Yes.
So it's a different mindset. So hopefully this does help with the retention of EMS clinicians, where they can take a break for a few years, or as part of their role, maybe 3 days a week they do MIH community paramedicine, and the other 2 they do urgent. There's different ways in which we can approach this, but I do think there's an opportunity there, and my hope is that we can get the word out there and the understanding to EMS clinicians as to what this MIH/CP thing is, and the potential benefits that, if they're interested in incorporating into their operations, the benefits it could have to retention more.
And I do think it's really important that EMS and clinicians know more about mobile integrated health, because I believe that if people don't go into EMS with eyes wide open, and I think that's a huge retention problem. You were talking about the 5-year lifespan, because they think they're getting into EMS to
save lives.
To save lives, right? And they think that every single call is going to be something out of, the 911 shows that are on TV, that people have gotten swarmed by a tornado full of bees or something like that. And in reality, you are performing a variation of mobile integrated health right now. You are being summoned to go to somebody's residence, and there is something abnormal about their health state, and you are there to provide a health screening and determine whether or not this needs to be escalated to the emergency level. And you're prepared for it to be that, but really, you're just kind of catching someone when they're not at their best and trying to see what they need. And and that's only going to expand. That role is only going to expand because we're the social safety net. So if you don't know about mobile integrated health now, and you aren't prepared to know more about it, you actually aren't currently at EMS.
Good point. Is there anything else you'd like to share with our audience as far as hot trends, up and coming topics you might be covering on your channels?
Well, I've been going to release today, talk about some of the changes that the AHA has recommended. One of which is, going to catch people a little off guard, which is the recommendation against a routine use of mechanical CPR. So that's something I'll be talking about a little bit. It's not actually too much of a change from their stance before. It's just a little bit more of a, okay, we really mean it. But it still kind of allows for the instances of low resource environments, transport environments, and stuff like that. I just want to say that I'm not necessarily happy about that, because I think it focuses on the wrong thing. If you were to take mechanical CPR off of every single truck in America right now, nothing would change about survival. And so it doesn't focus on the things that improve survival.
Yeah, the irony is the American Heart Association is right behind us, so everything's right there.
So we can have it out right after
Yes, yes. Thank you so much for joining me for this episode. And people can go to @EMS Avenger to follow you on your various channels. And thank you for what you do for EMS. It's really, it makes a difference. It means a lot to a lot of people, and we appreciate you coming on. I appreciate you coming on this episode and spending some time with me.
Absolutely, my pleasure.
Thank you as well for joining us, and as always, stay safe.
Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nrmt.org. Thank you very much, and again, stay safe.